Hello and welcome to a special edition of The Right Show. I have the opportunity today, as my first interview since becoming a doctor, earning my honorary doctorate degree at the Nerenberg Graduate Institute, an opportunity to interview my supervising professor, Dr. Arnold Nerenberg. He's known worldwide for his work in road rage. He has developed and innovated such therapies as the death visualization therapy, as well as the mind-body workout and the dialogue of social revolution. He's a family man. Some of you probably don't get to see when he was doing Montel and Sally and Jenny Jones and all those other talk shows. But he's also a family man. He's the father of 6 and adopted and some adopted. He became the strongest man in the world after prostate cancer and a heart attack. It gives me great honor and a privilege, with some excitement, to present to some and introduce to others Dr. Arnold Nerenberg. Would you give him a round of applause? Dr. Nerenberg, thank you for letting me come into your office. Thank you for taking the time to sit with me.
Well, I'm honored to be here with you, with those in the room, my dear brothers and sisters, my beloved wife, Maheen. It's an honor to be with everybody here, and those watching on DVD and those listening on CD. Thank you for that very generous introduction. Thank you.
Dr. Nerenberg, it's my ambition here to let people understand and get to know a little bit about the man behind the therapies and the philosophies. I got an opportunity to learn you quite well over the last 3 years, and but some of the things I think people don't get to see, because you do a seminar every week. You want to talk about that and let us know what you do the seminars at your institute, the Nerenberg Graduate Institute?
Yeah, each week it's a different topic that we present here. It could be how to overcome anxiety and depression through living in the moment. It could be social revolution of dialogue, the psychology of motorcycle riding, the psychology of guns and feelings of whole protection, diabetes, how to overcome diabetes, empowerment of tribulation, dealing with prostate cancer. Lectures on cardiovascular disease and stress, also how economics affect us personally and emotionally. And a lot of my DVDs have to do with communication, respectfully real communication.
Now, how was those topics that you just talked about, you just gave us a laundry list, how were they inspired by you, and how can people use them?
Well, inspired is the correct word. I always tell people that my ignorance knoweth no bounds. People can ask me questions about many things, and I tell them I'm ignorant about that. I've developed one, call it an ability or a gift. I can read the book of my own heart. And so when I want knowledge, I primarily look within myself, and within my own experience, my own heart, and all the knowledge just flows forth. After I say many things on these lectures, if you ask me what I said the next day, I couldn't tell you. So it's not something I go by memorization, it's more inspiration. So the guiding principle is, what can I do to serve humankind? And before every lecture, I turn to God and I say, how can I best serve today? And then thoughts will come. And usually that walk takes place about 10 minutes before the class, and I get more ideas, many ideas. And so sometimes the lecture doesn't really start coming together till maybe 20 minutes before the class itself, because it is based on inspiration.
That's exciting. I'd like to talk a little bit more about the Nerenberg Graduate Institute. How was that inspired, and what do you augur to do with that?
Well, the Nerenberg Graduate Institute, a friend of mine suggested, well, you should have your own institute. It was his idea, the Nerenberg Institute. And then it became the Nerenberg Graduate Institute, and then also an offspring, the Nerenberg Institute. And it's been an opportunity to develop the mind-body workout system, a place to try to inspire others, to uplift others, to give basically the guidance I wish I had when I was a younger man. At the age of 69, I'm showing my younger patients, I'm showing them how to live a better life, how to overcome their anxieties, their depression, their angers and resentments, giving them guidance that I wish I had had. So I said, I don't want you to go through a lot of things I went through. I hope you can then stand on my shoulders. So I'm able to, both in terms of their health, emotional and psychological health, and their physical health. We take the blood pressure of the patients who come in. I work out with them. I show them exercise routines. And I tell people that the so-called waiting room is no longer a waiting room. It's a program room. It's a place where they can work out. We have exercise equipment, and we have the DVDs from the Nerenberg Graduate Institute playing there so they can be learning. And I take the DVDs and also lend it to my patients to take home with them and keep uplifting themselves through watching it and learning.